Okay, I think we can start. Hi, everyone. My name is Payal. I work as a Senior Program Manager at Vielight. Thank you all for attending today's webinar. Vielight and BioFlex are proud to announce this new alliance partnership where we're focusing on educating and providing effective photobiomodulation therapy devices, both for brain wellness as well as for everything from brain wellness to management of muscle, joint, and nerve injuries, arthritis, wound healing, and skin conditions. A little about BioFlex. So, BioFlex laser therapy has over 30 years of clinical experience built into their consumer and professional photobiomodulation service devices. This webinar will provide an overview of BioFlex as well as an insight into how photobiomodulation can accelerate healing, reduce inflammation, pain, and other symptoms that are related to injuries and progressive conditions like arthritis. Our presenter for today is Dr. David Kunashko, the medical director at BioFlex Laser Therapy. Hi, David.
Hi, Payal. Thanks very much. I appreciate the introduction. And as Payal mentioned, we're quite excited for this partnership, announcing this new partnership. Before we get started, though, I want to make sure, first of all, that everyone can hear and see the screen and hear my voice. Just let me know in the chat box if that's the case. I see there's a few people that have mentioned that they can hear and see the video and so forth. Which is good. And I'll ask Payal, she can turn off your camera and we'll get started. Great. So as Payal mentioned, the medical director here at BioFlex Laser Therapy, and we're doing two webinars on the partnership initially. One is from BioFlex, which of course is who I represent, and geared towards the Vielight audience. And Dr. Liu Lim will be doing one similarly to the BioFlex user group, clients and healthcare professionals and consumers at home with respect to their company and brain wellness. I do want to remind everyone that for future webinars and for this one as well, this will be recorded. We then edit it and send out a follow-up email to all those that have registered and attended the webinar. So if you want to watch it again or have interest in seeing it, or perhaps you weren't able to make it live, then you can watch it again at another time. So really the focus of today is for me to introduce BioFlex and what we are about, and specifically a little bit more about photobiomodulation therapy and how it works in other areas of the body other than brain wellness. And of course, Dr. Liu Lim will cover that on July 31st. And I'll go into a little bit about our company, the devices that we have, how we work. I'll ask whoever has their mic on to turn that off. And then we'll always have time for question and answers at the end. You can type those questions in at the very, as we go along. Certainly, I'll get to those at the end of today's webinar. Okay, as Payal mentioned, that we actually have started this partnership a little while ago. We're out in Vancouver together, both Vielight and BioFlex, where we did an introductory webinar, or sorry, introductory Light Up Your Practice, which was a live event in Vancouver for healthcare professionals interested in photobiomodulation for both brain wellness and for musculoskeletal and nerve conditions, as well as an advanced certification training course on post-concussion syndrome. And we'll be actually doing another one of these in Toronto in September, and I'll announce those dates and the details at the end of today's webinar. So a little bit about BioFlex laser therapy, as Payal nicely mentioned. We have a long clinical track record. In fact, we were the first manufacturer of photobiomodulation therapy devices in North America. Our founder is Dr. Fred Kahn. He has since passed away a few years ago. Now, he was a vascular surgeon by profession and practiced in both Canada and the United States. He eventually semi-retired back up to, he actually practiced in California for many years. And he decided to sort of semi-retire back to Toronto. And he was having a few injuries along the way with his activities, including a rotator cuff tendon tear skiing, as the story goes. And so what happened was he had a friend who is also a chiropractor, and this particular chiropractor, Don Fitzritson, was one of the first healthcare professionals, probably in Canada and probably North America, that had a low-level laser therapy device. And it was actually a Russian device. At the time, they were extremely rare in North America. It was a little bit more popular in other countries, including Russia. So the story goes is that he really helped Fred Kahn with his shoulder injury. Quite impressed because Fred was trying to avoid surgery. And again, I'll just ask if you have your mic on to turn your mic off. And with his injury recovery and avoiding surgery, he got really interested in this particular type of therapy. At the time, it was called low-level laser therapy or low-intensity laser therapy. And that gave him a bit of an idea. He was a bit of an entrepreneur as well, and he decided to look more into photobiomodulation therapy. He ended up working with Ryerson University. It's now called Metropolitan University in Toronto, and he started to work with individuals there to develop a new type of laser therapy device. He worked with researchers around the world, including the United States and the UK and Russia, in order to sort of establish the wavelengths that were appropriate at that time, understanding the research, pulse rates, and so forth. And he put together some equipment and started to do some clinical trials, mainly based on musculoskeletal issues, everything from osteoarthritis to wound repair and so forth. Quite successful these trials were, and they ended up developing a company that is now known as BioFlex Laser Therapy. Our parent company is Meditech International. So our sort of logo is we're designed by clinicians for clinicians and consumers. With our long track history, we do help a lot with healthcare professionals using laser therapy equipment in their clinical practice, as well as consumers at home. So we really have two branches of the BioFlex family and devices. We have a BioFlex Professional. That's where we actually first started back in the 1980s. And over the years, we've developed consumer at home devices as well. And I'll be talking a little bit about all these devices as we go along. And remember, you can just ask questions, just type them into the chat box. I'd appreciate that. We're also involved a lot in professional development. As I mentioned, we do in-person events, and we also do live online events like these. And I'll talk a little bit about those as we go along. We tend to do a lot of public education just to raise awareness of photobiomodulation therapy. We're involved in a lot of research and development, including clinical trials and our own development of new equipment, as well as we offer clinical and technical support for all of our equipment. And for healthcare professionals, we help you manage your laser therapy equipment in your practice with respect to sales support and practice management support. So really, this is what our company does. All of these facets are built into BioFlex Laser Therapy. We are stationed in Etobicoke, West Toronto. So if you ever want to drop by and visit our clinic, we have a large outpatient clinic that's on Horner Avenue in Etobicoke, and we have a corporate headquarters in Etobicoke as well, and a manufacturing facility nearby. Over the years, we have established both FDA clearance and Health Canada for Class 3 medical devices and Class 2 medical devices. We're CE and UL certified. We have ISO 13485 as a medical device, and we have quite a few patents with respect to our technology. As I mentioned, we're quite involved in research, as Vielight is as well. Most of our research is not necessarily in brain wellness, although we have done a small pilot trial on post-concussion syndrome. We do offer our equipment and our expertise in certain clinical trials, currently large ones going on, one specifically at McMaster University at 2 hospitals in the Hamilton region for wound healing and pain control post C-section, and that is wrapping up and should be published by the end of this year or next year. We also have a large trial going on in the Ottawa area through the University of Ottawa for vestibular dynia, and we have some other trials going on throughout the world as well. We have quite a few partners from professional teams. We just signed a long-term contract with the LA Rams. I was down in Los Angeles a couple of years ago, and I trained all their trainers on laser therapy. They had all sorts of laser equipment already, as you can imagine. And it just so happened that their quarterback, Stafford, had used our equipment to help overcome an elbow injury. And so he was quite an advocate for our equipment, ended up getting that introduction. We trained up their staff, and they gave us a year to see what we could do with their athletes. And in fact, all their players were really liking our equipment, especially for recovery of injuries in between games and training sessions. And so now we're the preferred provider of laser therapy devices to the LA Rams, along with other teams and associations below. Okay, let's get into a little bit about photobiomodulation therapy. And there's lots of different names for this. And I'd like you, if you could, share with myself as we go along, perhaps where you're from, if you're someone at home, like a consumer, not necessarily a healthcare professional, where you're located. You can just type that into the chat box so everyone knows. And also, if you're a healthcare professional, it'd be great to know where you're located. You don't have to say your name if you don't want to, but certainly what kind of healthcare professional that you are. Just gives us a little bit of information, and especially for me to understand who my audience is. So you can just type that into the chat box as well. The terminology has shifted over the years, as I mentioned, and the consumers out there oftentimes hear about red light therapy. That's what is often used in social media. However, I'm sure many of you are aware that that terminology is not really what's used in research, and I'll get into that a little bit right now. So there are two large associations for photobiomodulation therapy, WALT, which is the World Association, and NALT, which is the North American Association. And they have defined PBMT, or photobiomodulation therapy, as a form of light therapy that uses non-ionized forms of light. And it can be in different types of diodes, whether it's a laser diode, a light emitting diode, or even broadband light. And typically it's in the visible and infrared spectrum. It's really important to understand that this type of therapy is non-thermal. So in other words, it's not going to heat up the skin. There's no risk of burns. And each diode has to be under 500 milliwatts total power. If that power is exceeded in one diode, it starts to heat up. Even at 500 milliwatts, it can potentially start to warm up and heat the tissue. So if it's in direct contact with the skin, it can cause a burn. Also, heat inhibits the photobiomodulation reaction inside a cell. So we're not looking for a thermal reaction. This isn't the result of a thermal reaction. So what happens though is the light is absorbed by what's referred to as endogenous chromophores, or these are just photoacceptors inside cells, and they cause either a photophysical or a photochemical event inside the cell. And I'll talk a little bit about that as we go along. This whole process with respect to absorption of light inside a cell can be very beneficial therapeutically and can help alleviate pain, reduce inflammation, modulate the immune system or white blood cells that control inflammation, and really most importantly is help with wound healing and tissue repair. And that's where we as BioFlex use it a lot to treat different conditions that I'll get into. How it works is relatively complex, but but I'm going to, go over it in some detail, but not eye-watering, fall asleep detail. If you're interested in that or more information, I have a lot of different webinars on our website that you can refer to, and also Vielight as well has lots of information on that. But just getting a little bit into how this works is that when light of specific wavelengths get absorbed, it has an effect on releasing nitric oxide. And I'm going to talk about how that works in a moment. And this displacement of nitric oxide leads to secondary and tertiary reactions inside a cell that help protect the cell, increase the metabolism of the cell, and help repair and regenerate wound healing or tissue healing or injuries, whether that's a nerve like a post-concussion syndrome or an inflammatory process or an issue in the brain, like Alzheimer's or dementia, these kinds of depression. Oftentimes there's issues going on there, and I'll let Lou speak about that. But with respect to the musculoskeletal system and the peripheral nervous system, with respect to injuries or long-term chronic conditions, it can really help with these types of scenarios. So really, the main mechanism at heart, as I'm sure a lot of you are aware, is the mitochondria. And everyone is probably aware here that mitochondria are really important inside the cell because it produces energy for the cells and your body to run. So it's really well established that as you get older, your mitochondria lose their efficiency, the cells lose their numbers of mitochondria, and the ability for cells and tissues to repair, of course, slows down. But when you have an injury and inflammation, you also have a release of intracellular inside the cell nitric oxide, and this can be very damaging, especially at high levels inside the cell. So let me explain. Normally in a cell, we have the electron transport chain, which again, I won't go into a lot of detail here, but it's important for aerobic respiration. So essentially combining oxygen, and gradient pump, and along with an energy source, typically glucose from the Krebs cycle, you will produce ATP from ADP. Now, adenosine triphosphate is the energy currency to drive cells to function, whether that's release of collagen for wound repair, skin health, tendon repair, any kind of repair that's going on, or muscle repair, bone cell repair. This is really important that the cells have enough energy in order to repair themselves. So this is what happens in a normal, healthy cells and tissues. As I mentioned, inflammation is not good. When inflammation ramps up because of an injury, because of a disease or what have you, this causes a spike, an increase for a prolonged period of nitric oxide. Nitric oxide is a very interesting molecule inside the cell. In low levels, it actually has positive aspects, positive effects, but in high levels, it can inhibit aerobic respiration. It does that by binding to specific photoacceptors or chromophores, typically copper and iron, within an enzyme called cytochrome C oxidase, or CCO, along this electron transport chain. So when it does that, it actually inhibits oxygen from doing its thing and the proton gradient pump, and therefore the amount of ATP that can be manufactured by the cell diminishes. So the metabolism of these cells and the tissues is impaired. So really the goal of therapy, whatever it is you're doing, you want to try and reduce inflammation to allow the cells and the tissues to repair and regenerate. So what we're trying to do with light therapy is accelerate the inflammatory process and resolve it faster than it would on its own. And how does light therapy do that? Well, first of all, we need to understand that light is a form of energy. And this form of energy, photons, can be absorbed by these different photoacceptors. In this case, I did mention a specific one called cytochrome C oxidase. The energy of this light, red and near infrared, and I'll explain why it's near infrared, red and near infrared, why they're used. But this energy breaks the hydrogen bond between nitric oxide. Remember, nitric oxide in high levels is inhibiting oxygen from binding. And it does that by absorbing preferentially to copper and iron in this enzyme. You can think of it, a sort of analogy is carbon monoxide poisoning. Carbon monoxide poisoning works, and it actually binds to the same receptors as oxygen in your cells and prevents metabolism and aerobic respiration. The cells can't function, and because it blocks out aerobic respiration, your body can't function anymore. And of course, you would die in prolonged carbon monoxide. Well, nitric oxide isn't quite as potent, but at high levels, it inhibits, it preferentially binds over oxygen, and therefore the ATP levels go down. Now, when light therapy hits these hydrogen bonds, it dissociates nitric oxide from binding on copper and iron subunits. As you constantly sort of bombard these cells, then oxygen can start binding back onto the subunits inside cytochrome C oxidase. And you might say, well, why doesn't nitric oxide just bind back on? Well, nitric oxide has a very short half-life of about 5 or 6 seconds. It's also freely diffusible through the cell membrane. So what happens is, as the nitric oxide is sort of dissociating back away from cytochrome C oxidase, some of it breaks apart, some of it diffuses through the cell membrane, and eventually, with the light coming in, it allows to reestablish this proton gradient pump, the electron transport chain, aerobic respiration, and of course, ATP. So as you're doing this therapy, the energy, the metabolism of the cell starts to be repaired or restored. And the trick about light therapy is that it's not a quick treatment. It's not designed to be a few seconds. It's typically longer than that. In fact, longer treatment times are actually better than shorter treatment times because this reaction has a longer time to take place and therefore more of a profound effect. We know that a lot from research as well. Okay, so that's one of the key mechanisms. There are some other ones that I won't really get into with respect to calcium ion channel, even water acceptors. But this is the key mechanism. Now, you might sort of wonder why red and near infrared wavelengths are the best ones to use. Well, it really comes down to the absorption of this cytochrome C oxidase by different wavelengths. And it can absorb. You can see here's a diagram, and it shows you wavelengths at the bottom, and it shows you the activity of the enzyme by this black line. You can see it's very active at different wavelengths. The problem with some wavelengths is that, for example, green and orange are highly absorbed by hemoglobin. So if you use those wavelengths, they tend not to penetrate very deeply through the skin because they're being absorbed by hemoglobin. Therefore, it really isn't effective for absorption by cytochrome C oxidase. As you get to be longer wavelengths, as you're pushing into red, the absorption by hemoglobin goes down because it reflects red light, and you can start to be absorbing more by cytochrome C oxidase, which is what you want to do. Now, you might say, well, why don't we just use red because it's so effective? Well, that's true, but red doesn't penetrate very deeply, in part because it's absorption by other photoacceptors. But you can see there's another spike in the near infrared around 780 to 900 nanometers. Wavelengths seem to be in the low 800s, give or take, although some other wavelengths are starting to be researched as well. But you can see here water is also absorbed at higher wavelengths. So there's a window that you need to avoid water absorption, avoid hemoglobin absorption in order to target cytochrome C oxidase and the goal of photobiomodulation. So therefore, we use red and near infrared wavelengths to stimulate cytochrome C oxidase, as I just mentioned, and to avoid absorption by other photoacceptors like water and hemoglobin to allow for maximal absorption by this specific enzyme. Another important aspect of photobiomodulation therapy is the biphasic dose response. And this essentially is very fascinating because in early research, the clinical trials oftentimes weren't working. Some worked, some didn't work, and they weren't really quite sure why. And we now really have a better understanding that the amount of light or the dosage of light is really critical. Because if you have, say, from A to B, so if the chart you're looking at essentially here is the reaction, the photobiomodulation reaction. At low levels of light, like too low to cause a reaction like A to B, there's no therapeutic effect because there's not enough light to actually cause this reaction. I'll give you an analogy. You take a string of Christmas tree lights off your tree that are red and you wrap them around your knee hoping they're going to do something. Not going to do anything because there's not enough energy in those bulbs to cause that effect. Okay, you need a lot more energy and specific areas to cause this effect. So as you increase the light dosage or intensity, especially in a specific area, then you start to get a photobiomodulation effect. And there's sort of a window, you can see a sort of C to D, where there's an optimal amount of light that causes an optimal amount of therapeutic effect. Now, the problem though is if you have too much light, the effect becomes lessened from C, you can see here from D to E1. And if you have way too much light where you're getting heating going on, then it becomes inhibitory. So the goal of photobiomodulation therapy is to have enough energy, a maximum amount of energy to cause this therapeutic effect without having too much, that limits it, or too much that causes inhibition, or not enough to cause no reaction. This is called the biphasic dose response, is very critical and built into not only our products, but Vielights as well, through understanding about the research, both, companies that have carried out that research, and of course, research that's published in the scientific realm as well. Now, another point I want to mention about photobiomodulation is that it has direct effects and indirect. So let me explain. Direct effects is just exactly what I mentioned. The light is absorbed by a cell or cells in tissues. That could be the brain, it could be your biceps, it could be your Achilles tendon, whatever's going on. And this light will have a direct effect if that's going on in the cell. In other words, inflammation or an injury, right? So that's a direct effect. There's also something that's really powerful called a systemic or indirect effect. And I'm going to show you an experiment that explains this quite well. But this indirect effect is essentially treating the blood that's flowing underneath the light that you're emitting through the skin. This light is absorbed by circulating white blood cells, by platelets, by stem cells, and it causes immunomodulation. In other words, it has an effect on these white blood cells in a positive way, anti-inflammatory effects. If you're not aware, white blood cells control inflammation, and they can be in two states, an inflammatory state or an anti-inflammatory state. In an inflammatory state, they secrete substances called leukotrienes or cytokines that control inflammation, actually ramp it up. That's what happens when you first have an injury, like a sprained ankle or what have you. But then eventually there's a shift towards anti-inflammatory state, and you want that shift to occur relatively quickly by, using ice or initially perhaps, but then also doing different types of therapies. And photo is a great one to use because it has an effect of the blood that's circulating around that injury to control the state and shift it more towards an anti-inflammatory effect. Of course, that blood travels everywhere and deeper into the area. Like if say you're treating around the brain, like Vielight does, then of course you'll have this effect that's promoted through the circulation as well. So that's really important to understand. So let me explain how this works with respect to real research. In this particular published research, it's called low-level laser therapy to the bone marrow, and it reduces scarring and improves heart function, myocardial infarction in a pig. So I'm going to explain what they did here. So essentially, they had pigs, and they used a balloon catheter. And they would expand the balloon catheter in one of the coronary arteries of the heart to induce a myocardial infarction. Some of these pigs, before that happened, they inserted a catheter directly into the bone marrow in the tibia and the ilium, or the hip area of the pig, to irradiate the bone marrow. And in others, they had control, so no light therapy. And what they did was they looked at the healing rate and the amount of tissue damage in the heart, whether it was post laser therapy or the placebo or the control. And essentially, without going into a huge amount of detail, it's all in here, is that there was 68% less tissue damage in the heart on the pigs that were treated with laser therapy in the bone marrow. So essentially, this light therapy had a systemic effect. They didn't treat the heart, they treated the bone marrow, and it increased the number of circulating stem cells. Specifically, the more stem cells that you have, the more the ability of the body to repair that tissue damage. So you can graphically see it represented here, where the white represents scar tissue. You can see this one right here I'm showing you is the non-treated pig's heart. And then on this one here on the right, you can just see a really small section of scar tissue that was a laser treated. And you can see the different coronal sections comparing laser, like non-laser to laser, non-laser to laser, non-laser to laser. And each of these, you can see the cross sections, that there's a lot less tissue damage and better recovery through using laser therapy. So one way to actually that we can achieve benefits of photobiomodulation is treating over not just bone marrow, but also the blood that has stem cells. It actually increases their numbers or circulating numbers that can help repair tissue damage as well. The net effect of the physiological effects of photobiomodulation are quite vast. It almost seems too good to be true how it works, but the reason for that is this mechanism on the mitochondria, because every cell type has mitochondria and they all work the same way, whether it's a neuron, whether it's a bone cell like an osteocyte, whether it's a muscle cell, um, um, a myofiber, a skin cell, a tendon cell, a tenocyte, whatever it is, it works very similar. It can help improve blood flow through angiogenesis and neovascularization. It can help improve collagen production and maturation, repair muscles, help reduce inflammation, as I mentioned, reduce edema or swelling. And it can help different tissue types heal faster or regenerate, like nerves, cartilage, and bone. And we use all of that with our BioFlex laser therapy as Vielight uses it for brain applications. Those of you who aren't aware of PubMed, if you search PubMed, P-U-B-M-E-D, on the internet, you will essentially get most of the research that's published in scientific journals. So I did this search just the other day, and if you search for photobiomodulation or LLT, which was the old acronym for photobiomodulation, called low-level laser therapy, you can see here it pulls up about 11,300 research papers. So that's a lot of research. And then if I want to look at clinical trials, so these are human clinical trials, the numbers are over 1,900. We're getting close to over 2,000 human clinical trials on photobiomodulation therapy. Every year, there's 300 to 500 papers published on photobiomodulation therapy, and maybe 100 to 200 are clinical trials. Okay, so let me get into what our company is about, BioFlex. We treat a lot of different conditions, and we're focused more on the musculoskeletal, the peripheral nervous system types of conditions. Well, of course, we do use it for neurological. Our is in the systemic effects with respect to those types of issues. And I'll leave it to Lou to talk a bit more in depth about how PBMT can help brain-related issues. But for our equipment, we tend to use it for muscle injuries, ligament injuries, tendinopathies like tendinitis or tendinosis, fascial tears like plantar fasciitis, cartilage tears like meniscal knee damage or labrum in the shoulder or the hip, a joint degeneration like osteoarthritis, fractures, bursitis, joint inflammation, again, like OA or RA, contracture disorder, like Dupuytren's contracture. So what I'd like to do is present some case studies as I talk a little bit about the applications. This first case study, now these are our case studies or case studies done by BioFlex healthcare professionals. This first one is a non-displaced vertical longitudinal tear of the posterior horn of the medial meniscus. That's in the knee. This was actually done by Dr. Miguel Cruz on one of his patients in North Carolina. And this patient had a non-displaced tear that was quite significant in the meniscus. And the practitioner, Dr. Cruz, did roughly 20 sessions over 3 months. The patient had a follow-up MRI. And on that follow-up MRI, this is 3 months later, the MRI indicated there appears to have been healing of the vertical longitudinal tear previously noted in the periphery of the posterior horn of the medial meniscus. And if you're aware of healing of a cartilage or especially the meniscus, for healing to occur in 3 months or at all is fantastic. That's a really good result. So it just goes to show you that if these types of injuries can be helped due to the nature of how light therapy can work. We've treated things like fractures and sprains. This is a gentleman that sprained his ankle playing volleyball. You can see the hematoma here. He also had a small fracture in the one of the bones of his foot in the metatarsals, in the fifth metatarsal in that area. We treated him over 3 to 4 weeks. And you can see here's one of the final pictures, and we got him actually completely walking normally, ambulating freely, no need for crutches or the air cast after about 4 weeks of treatment. That was around roughly 2 to 3 sessions in a week. This next one is by Dr. Ben Ewan, a Halifax. I think he has 15 or 20 of our systems. This gentleman had a fracture. You can see it here on evidenced on the X-ray, and he was waiting for surgery. It was deemed stable, so apparently they were short-staffed out in Halifax and weren't able to do the surgery. So they asked him to just put him in a sling and rest it up until they could get him in for surgery. He went in to see Dr. Ewan and said, "Hey, can you do anything about this? At least help me with my pain." So Ben started to treat him using the equipment over that area of the fracture, and ended up when the patient went back. This is about, I think you can see here, he presented on October 25th. And presented about a month later for follow-up x-rays. And at the orthopedic surgeon, they actually felt that there was enough callus bone formation that he didn't require surgery. So it can really help bone healing in many different ways. Of course, sometimes you need surgery, but in other cases, if it's stable, you can actually just get away from using screws and pins if it's stable, and to help with the bone formation. We treat conditions like olecranon bursitis or bursitis in general. You can see here is a classic example on the when you're leaning your elbow too much against a table or what have you. You can see this was about 6 sessions over 2 weeks. And muscle injuries like a hamstring injury. This person injured their hamstring playing golf. You can see the large hematoma that was a result. And you can see here, this was 4 sessions over about a week. And you can see the hematoma was already resolved. We still would have treated him for another week or two, especially at the origin of the hamstring along the hip bone here. But you can just see how quickly that hematoma was resolved. You can also use light therapy, especially BioFlex for herniations, nerve compression, neuropathies, neuralgias like trigeminal neuralgia, nerve compression syndromes, nerve healing, spinal stenosis. And here are some cases that I want to present on those conditions. This was a disc herniation in the cervical spine. It was a left paracentral and neuroforaminal region, C6 and C7. The exam date was June 14th, 2004. And then in February 2005, so it was about 8 months later, the follow-up. Now, this patient just had laser therapy. It was one of our patients at our clinic. And the follow-up CT here showed that the disc herniation that was previously evident was no longer there on the CT. So again, getting complete resolution of a disc herniation in 8 months is actually quite good. We can also use our equipment for treating skin conditions like acne, eczema, dermatitis, psoriasis, rashes, herpes zoster, for example. And here are just a few case studies out of our clinic. This is a before and after of treating psoriasis. I'm not going to spend a lot of time on these case studies. I just want you to kind of see the kind of results that we've had over the years. Another quite a severe case of torso psoriasis, the initial, and you can see after 4 sessions. Eczema, in this case over the axillary region, quite inflammatory. You can see here that it helped to resolve that relatively quickly. We treat cosmetic issues, or not even really, I wouldn't say acne is a cosmetic issue, but you can see treating acne helps with the inflammation and helps to resolve these outbreaks as well. We treat a lot of herpes zoster, shingles. You can see postherpetic issues in the lower back. This would have been one of the dermatomes affected. You can see the initial presentation and about 1 month later with fairly good resolution. And we treat things like keloid scars. This is a younger boy with a pretty large keloid scar, and it actually helps to transform and reduce the collagen in a keloid scar. We use BioFlex for lymphedema or swelling, improved circulation, improved vasodilation, and stem cells, as I mentioned earlier, and immunomodulation. in one session, one patient case study here, a lymphedema. Here we wrap our large surface array around the edematous area. You can see after 9 treatments, that would have been about 3 weeks. We've got probably 40% reduction of lymphedema. Here's a really classic example of increased circulation through angiogenesis and neovascularization. This patient was scheduled for surgery, had tried different therapies, including hyperbaric chamber. And due to complications of diabetes, you can see there's dry gangrene upon initial presentation, and you can see the progression. This would have been quite a long time. It took us roughly a year to resolve this condition, but you can see because it increased not just temporarily, but long-term circulation through angiogenesis, you can see that the dry gangrene actually resolved completely, and we actually saved this patient from having amputation of her forefoot. Again, I'm happy to take questions. Just type them in as we go along. And we use our equipment to treat recalcitrant wounds that are chronic wounds that aren't healing, ulcers, abscess, sores, excuse me, in the mouth, oral herpes sores. Sorry about that. Post-surgical healing, burns, lacerations, bruising, as I showed you earlier. And here are a few case studies to demonstrate that. You can see initial presentation of a post-surgical wound where screws and rods were implanted. And you can see after 3 sessions, starting to get really nice healing. The staples were removed. And after about 2 weeks of treatment, that was 5 sessions, you can see minimal scarring and really nice healing of the post-surgical wound. Similarly, post-knee replacement surgery, you can see the initial presentation, and after 5 sessions, you can see significant reduction of edema and reduction of the hematoma and improved healing. And remember, this is about a week and a half post-surgery, so it really does help post-surgical healing. Just a reminder to type in your questions in the chat box, not the Q&A. I've been having difficulties with the Q&A box to open that up. This is a dermal ulcer, initial presentation. After 4 sessions, after 6 sessions, that would have been about 2 weeks. You can see complete closure of that wound. We treat burns, for example. This is a young boy that backed into a barbecue. You can see nice resolution here. And of course, we treat cosmetic issues. Not really our specialty, but certainly we have used it. And we even have some clinical trials on this as well too. So aging skin, collagen formation, skin toning, hair loss, these kinds of things. So some classic case studies of you can call them stretch marks or dry eye post-pregnancy. This was only after a few sessions, so about a week or so, and get nice resolution there. You can see this case was done by a chiropractor at West that was using our equipment on a young lady that had a very specific type of alopecia. They're not really quite sure of the etiology. It could have been hormonal. They're not really quite sure, but you can see large patches of hair loss. And this was the result over about a month of treatment. It works really well for these types of cases of alopecia. There's also some really interesting emerging clinical indications that we've been using our equipment for, everything from irritable bowel syndrome, Crohn's disease, to endometriosis, things like even fertility it's being used for, and also things like dry macular degeneration and myopia. Not so much lasers, but LEDs. They're finding that it's been very helpful for these kinds of issues as well. Light therapy, photobiomodulation has a really good safety profile. There are very few contraindications. Should you be more interested in this information or even want to use our equipment, I do a full training session on this, but just so you understand, typically it's not used directly over a growing fetus or suspected. You don't want to use laser into the eye. And certainly when I mentioned about treating conditions like macular degeneration or myopia, these are very specific dosages using incoherent light, not lasers. So I don't want to give everyone the impression that you can use a laser into the eye because that is contraindicated. You don't want to treat over the thyroid gland because it can affect that, or actively bleeding tissue because it causes vasodilation. A little bit about our equipment. First, professional side, we have three types of professional devices from multi-port, dual port to mini port professional. Really, they all work the same way. It just happens that the multi-port has four ports to use four different devices at the same time. So technically, you could treat up to four patients at the same time or multiple areas of one patient. The dual port has two ports, and the mini port pro has one active port. The hardware is used by all this type of equipment. We have a dual 240, a dual flex 180, and I'll talk a little bit about this in a second, as well as class 3B laser probes. These are very, very high powered with respect to the surface area used. High powered meaning it's still class 3B, doesn't cause any burns, but causes a really high energy density or power density in a small surface area. We combine these two types of devices. So a little bit about these devices. The large surface array that we call the dual array, these this type of equipment emits both red and near infrared light. It has a very large surface area of about 100 square centimeters. They're customizable, so you can change the pulse rate from 10 hertz to 10,000 hertz. You can change the power and the duty cycle in milliwatts. The diodes protrude out and touch the skin and push into the tissue, allowing you for better absorption of light and less reflection. They're hands-free, so you strap it into place and you leave it. We use clinically proven proprietary protocols we've developed over about 35 years or so. And the class 3B laser has, as I mentioned, a very small surface area to work with, about 0.1 centimeters squared. This results in a very high energy density for deeper and more direct healing applications. Our home care devices, we have quite a few of these from the mini port home to the P180, P120. These are handheld devices that you strap into place using very similar technology, integrated software, user-friendly, different sizes, different power outputs, but they all use the bicolor diodes and all use our proprietary protocols. We also have wearable technology. This is called the Nano, where you can strap or using two-way tape, stick it onto small areas that may be problematic. We also have the Surge, which is a dry cupping electronic device combined with photobiomodulation therapy using both red and near infrared light. This is the only device out there like that. And we have LED panels. And just so you understand, the LED panels aren't meant to be therapeutic. I'm not going to say, hey, use an LED panel to help your tennis elbow or, or your rotator cuff tendonitis. Where these are really beneficial is to treat a large surface area of skin, provided that you use it the way you should, a certain distance away, and expose that skin. And that can help with profound systemic effects in the body, as I mentioned earlier about systemic effects. We do have multiple websites. We have our BioFlex Laser, which is our professional website. We have BioFlex Wave, which is our consumer and home devices. And we have our BioFlex Laser Therapy Clinic. This is North America's largest laser therapy clinic based in Toronto. And we have a long track record of treating a lot of individuals with many different types of conditions, including a wound healing specialized treatment area for recalcitrant wounds or difficult to heal wounds. When you go to our website, especially the laser therapy website, you can see here, has categories like the different devices, accessories. If you want to go to the consumer site, the BioFlex Wave, if you're interested in online training, or if you want to attend one of our events like the Lab Your Practice, it can be found there. We have a lot of different educational webinars, like the ones we're doing today. We also have these different types of trainings from basic to advanced, and also host a masterclass. I should mention that we'll be working with Vielight on the advanced certification training for post-concussion syndrome. I'll talk about that very shortly. And we offer customer support, and we have archives of all these webinars, both on the personal home side, consumer side, and professional webinars that are complimentary and free to access, as well as to find clinics that use our equipment. Okay, winding down a little bit here. As I mentioned, we do offer complimentary webinars like the one today, and I did want to give a little shout out to Vielight that will be doing their webinar on July 31st. Dr. Liu Lim will be all about Vielight and the applications of photobiomodulation, typically we call transcranial photobiomodulation for brain wellness and different conditions and research that they're involved with. So I ask you to join in there. It should be really a fascinating webinar. As I mentioned, we have a lot of different archived webinars. I've been doing these for about, I don't know, 15 years or so. So we have quite a few. On the professional side, you can see they're for different specific conditions. Anyone can watch them. The professional ones are geared more towards healthcare professionals with respect to, knowledge of anatomy or physiology or biology. And I have personal webinars. These are for consumers at home that may not have a medical degree or a healthcare professional degree, but are using more these devices for at-home issues. Whether that's for a stiff knee or hair loss or what have you. I walk through how you would use our equipment for treating these kinds of conditions. As I mentioned, we have some upcoming events. So I do want to make sure that you're aware of that on July 31st for Vielight and Dr. Liu Lim. You can go to our website or go to Vielight's website to find information on how to register. And I did mention that we'll be doing a partnership with Vielight on September 6th and 7th in the Greater Toronto area at a hotel. The location will be announced very shortly around the airport area. And it's a 2-day event, a full day event on the September 6th. This is called Light Up Your Practice, more so for healthcare professionals, how you can integrate photobiomodulation into your practice, whether that's for brain wellness or for these other applications that I mentioned. And we'll be co-hosting and partnering with Vielight on this specific day. As well as a advanced certification training on post-concussion syndrome using PBMT, both transcranially and in other areas around the head to help with the symptoms and recovery of post-concussion. That's a half-day event from 9 a.m. until 1 p.m. And you can sign up and register and get that information on our website as well. I really want to thank you for joining in for today's webinar. I'm going to start looking at the questions here, so just start typing them in as I go along. And certainly, if anyone from Vielight has anything else to add in, Payal or Austin, just let me know. But I'm going to just start looking at questions here. It says if you use several devices in one day, so like for example the Vielight Neuro on the head, or somewhere on the body, like intranasally or the P180, is that too much light? And that's a great question. The issue with too much light has to do with over one specific area for too long. So typically, if you want to treat your knee and you want to treat your brain, that's perfectly fine. What I wouldn't want to do is say over-treat your knee or over-treat the brain. That's why when you're using the equipment, whether it's Vielight intranasally or around the head transcranially, on the knee, they're set up with specific parameters in mind to give the appropriate dosage for that specific area. So you would follow the guidelines of how often we recommend to use it on a specific day or weekly or monthly. So yes, you can use the equipment in multiple areas on the same day. Just another question here.
Hey, David, thanks so much for presenting that. So I was reading through the chat, and there is quite a bit of
Sure.
one common one that's been coming up is we've seen a lot of amazing results with things like the gangrene, the keloids, and all these different types of things. And a common one that we're getting is this capable of achieving these results with the at-home devices, or are these the in-clinic, in-person devices that's seeing these great results?
Yeah, so most of the cases I presented there were using our professional device, but I do want to mention that our home devices, especially the P180, P120, and home systems, the dosaging and the protocols are the same. So with respect to that, you would imagine seeing very similar results using home devices. You may need to treat a little bit more often because they don't include a class 3B laser probe. So one of the advantages of treating at home would mean that you could actually treat a little bit more often, like daily, for example, instead of 3 times a week to counteract perhaps for not having that laser probe. So one would expect to have similar results using, especially the P180, P120, or the home system. So I see a question here. With respect to the partnership, are there jointly developed products? Sorry, I'm just trying to get this question here. Are being released or mostly focused on raising awareness? Right. So currently, we're not actually working on developing equipment together. What we're doing with this partnership is, of course, hosting these events, hosting live training, also learning from each other as well, because we, with respect to what our equipment can do, but more revolved around the educational aspect with respect to photobiomodulation. I see a question here on a partially torn ACL and how you would use it. Well, with respect to an ACL, that's an internal ligament. So the effect there isn't so much directly because light can't really get inside that knee that deep. But when you're treating around the knee, especially at the circumference of the knee and the synovial membrane, you will have an impact on immunomodulation, which helps with tissue repair because, as I mentioned, the white blood cells are activated more so with respect to healing and anti-inflammatory aspects. So you would wrap it around the entire knee if that was the question. Seeing if there's any other questions here. So there's a question here about Vielight X Plus versus, BioFlex skin contact consumer devices like the Nano. Are they direct competitors? So here's the thing, and again, Vielight specializes in brain wellness. That is what they've established their research around. Their devices are all about that. And with respect to their knowledge and their research, that's what they focus on. BioFlex over the years has mainly focused on musculoskeletal, peripheral nerve conditions. While we've treated some of these conditions, and we certainly have also had promising results, we don't necessarily specialize in some of those neurological conditions or brain wellness per se, even just the way our equipment is made. So when it comes to things like these brain wellness issues, that is where, yes, you potentially could use BioFlex expertise of Vielight. That's where we're saying, hey, look at what they have, look at their research, and see what makes the most amount of sense. The Nano is not a device I would say, hey, use that for brain wellness. That's not what it's designed for. It's designed for pain and inflammation in small areas, on the extremities and similar areas. So hopefully that answered the question there. Which home product would you recommend or for use on various body parts from osteoarthritis? Feet, hands, back, and knee. So really, Pamela, that asked this question. The issue here is, it really depends on the extent of the issues, the progressive nature of the issue. There's many things to sort of look at. So we have several devices that could help that. What I'd kind of recommend is that you reach out to us directly, and then we could talk about what's going on specifically with you or whoever you want to use it for, and then we can make that recommendation as to what equipment might be best. I see a question here about pressure sores in the elderly. Certainly, you can use the equipment to help with pressure sores. That's a really common issue, and we use that quite successfully for that. How near can for LED panel? Okay, so for an LED panel, typically you want to be within about 10 to 20 centimeters of the panel. Too far, it limits the amount of energy going into the skin. So there is a certain distance that we recommend. I do have a webinar on using the panels, so you can just go to our website and look into that. So a question here, I live in Australia, I currently use in Southwestern USA. My work is in Aboriginal wisdom-based teachings. The relevance of your work might not be obvious. Best described as global, okay, Okay, I don't see a question there. Sorry. So I see a question here about how can a consumer distinguish between the many near-infrared devices for safe for sale and those that are clinically effective? There's a few things. First of all, you need to look at the history of the company. Are they actively involved in research like both Vielight and BioFlex are? How long they've been around? If they're actual clinically based company, and a research-based company, which we both are. And if their devices use or FDA approved, for example, medical grade, these kinds of things, and certainly if they have the support and the research around it. Most consumer devices for sale are reselling it from companies that produce it in China, and they're not real photobiomodulation therapy companies. I mean, I'm trying to be nice here, but a lot of them basically just open up shop, buy things from China, and then they sell them and they give information, presumably about red light therapy without actually having any clinical insight into using it on patients or in research. And that's what I would look for. There are very few companies like that. Both Vielight and BioFlex would be two of those companies that that I feel do that. A question here is, do you treat spinocerebellar ataxias? Ataxias are definitely a challenging condition. I've treated some ataxias. I don't know if someone from VLab wants to mention about if they've treated ataxias or not. Okay. Another question here, how does we compare it to anodyne? So I believe anodyne, if I'm not mistaken, they have like kind of like what looks to be similar to ours. But if you look at anodyne, the LEDs are spaced out really far apart. They don't protrude. They're not by color. And their their history isn't really anything near what BioFlex would be. So while they look similar, the energy density or power density is significantly less because they are spaced out quite far apart. So if you just look at the devices hand in hand, you'll see those differences. So can it be used to treat wet and dry macular degeneration? I think I mentioned that. There's research ongoing that is showing that it may be helpful for those conditions. We are not licensed or regulated to treat those conditions. Is there an opportunity to be a product representative in BC, Alberta, Saskatchewan area? We do have, Nancy, I'm not in charge of that. You can reach out to us and I can put you to the appropriate people there. It says something here about they are not contraindicated. I'm not sure what that means. What pre-treatment within session and post-treatment measures do you recommend? Again, I don't understand that question. Sorry. Is this treatment applicable to knee bone on bone? So bone on bone refers to end stage arthritis where there's really no hyaline cartilage left. And that's usually where you look at interventions like knee replacement surgery, but you can't have relief of pain and symptoms using our equipment for end stage arthritis. It's not going to regrow cartilage because there's no cartilage left to repair, but it can help with the swelling, the pain, and the inflammation. So hopefully that answers the question. How much are the professional units? Again, just reach out to us with respect to prices. I don't know which ones, and also I'm not in sales, so I'd have you reach out and I can put you to appropriate person.
There's a question, David. Has this been used on dogs with CCL tears? Have you used this on any animals?
Yeah, so we do a veterinary system, and we have a manual for veterinary protocols that was developed by Dr. Chip Godine, former president of the North American Association for Laser Therapy, and probably the world's leading expert on laser therapy for animals. So we have a compendium and protocols for small dogs, cats, medium, large dogs, and equine. Although you could argue some large cats are the size of medium dogs, but anyway, we do have systems for that, and I even have some webinars on treating animals, so you can check those out as well. Any other questions I may have missed, Austin?
So in the actual Q&A section, there's 6 questions there that I'm seeing. Would it help with frozen shoulder?
Yeah. So again, photobiomodulation will help with almost any kind of musculoskeletal condition. We've treated tons of adhesive capsulitis or frozen shoulder issues. There, what we do is we treat all the way around the circumference of the shoulder joint, including the axillary region or the armpit region. And so what it does is help reduce the contracture, reduce the chronic inflammation. And I would say that it would accelerate the healing, depending on what stage you're in, because there's 3 days frozen shoulder, but we've treated plenty, probably hundreds of adhesive capsulitis issues, and it can be really part of that therapeutic process. I do want to mention that when you're talking about therapy for musculoskeletal conditions, it's never in isolation. You'll always be doing other things. That could be other types of therapies, that could be exercises, whatever that is. But light therapy or photobiomodulation is really considered as part of that entire sort of toolbox that clinicians have to use or at home to use to help with the condition. Any other questions, Austin? Sorry, I'm trying to push through them, but it's just a little challenging for me here.
Yeah, not a problem. Um, I think you got the majority of the questions. It's all kind of similar to the use cases of it. So yeah, I think that's pretty much it. If there's any specific ones, what we'll do is we'll send you the full question list and we'll try to get back to everybody with a list of answers if we did miss any, but I believe we have got the majority of them.
Okay, that's great. Again, those of you who are still watching and tuning in, I really appreciate your time today. Thank you very much, Vielight, for the introduction and helping me with this webinar. And I look forward to introducing Dr. Liu Lim July 31st. That's on a Thursday as well for an introduction to what they do with brain wellness. Should be really fascinating. So I hope to see you all then. Thanks so much for joining.